Welcome back to my channel, and today's topic is aortic stenosis. As in previous video I discussed normal physiology and normal loops, and this one is a normal loop, and today we are going to discuss aortic stenosis. So as you may will be knowing that this is the aortic valve point where it opens. So in aortic stenosis, this valve is stenos means this is very stiff to open. So this ventricle will apply more pressure. Even it can go above 180 mmHg. So it will apply more pressure to open it. So this curve will looks like this, and due to narrowing of the opening of the aortic valve, left ventricle will be unable to eject the whole blood, so the volume curve will also be like this. So the ejection fraction, or we can say the stroke volume, will be decreased, but end diastolic volume will be somewhat same, because the left ventricle is not that flexible that it can relax more. So this is the aortic stenosis graph looks like. So now we will discuss about causes. So the most common cause is age related calcification of aortic valve, and other common causes are bicuspid valve that you see in Turner syndrome, and other cause is Williams syndrome, and other is the rheumatic heart diseases. So what happens in this situation? For example, this is your chambers, and this is your interventricular septum. So when the opening is stenosed, this will apply more pressure, and with time there will be thickening of the ventricular valve, and this will be concentric, means this it will be in parallel lines. The muscle fiber will be added in parallel lines, and the wall thickness will be increased, and in this conclusion the chamber size will decrease. And there is a point that usually boards like to ask. Here is a point that USMLE step 1 usually asks, that what is the differential between hypertrophic cardiomyopathy and hypertrophy due to chronic hypertension or aortic stenosis. In hypertrophic cardiomyopathy, the prominent hypertrophy or thickness is in that area, that interventricular septum. But in other two causes, it is global. So at that point, I also like to share about the murmur, what type of murmur we hear in aortic stenosis. It is called crescendo and decrescendo murmur, that it will intensify initially. You hear initially intensing sound, and then it will decrease as this graph is increasing sharply and then decreasing. This is the crescendo decrescendo murmur that you hear in aortic stenosis, and this murmur radiates towards the carotid. And if you like, please like, share and subscribe.